I'm Bern, for those who don't know me. Yeah. This is Lamnu. Lamnu is a diabetic educator, so we hear information from the horse's mouth, so we're not going to tell you things that we pretend to know. So Lamnu's here to educate all of us. We have Marie Chris. Marie Chris, you can introduce yourself.
Yeah,
what do you do?
Yeah, I'm Mary Chris. I'm a registered nurse, but I work mainly in rehab hospital.
So we've got some medical influences here, and we've got Colette, who's retired, but she's got a good background too, Colette.
Yes, I am diabetic, so it's good to know, the educated everything here.
So yeah, and Colette comes from a disability background too. She's helping a lot of people with disabilities. And our lovely Rachel.
Hello. So I'm a homeschool mum, so currently not working, but I am studying part-time. I'm studying health science and in Western herbal medicine, so that's my area of interest.
Fantastic. And I'm just a normal mum who loves food. I love food. Wherever food is, I'm around. So today we're going to demonstrate a few things that we can eat and make it tasty, and then we'll all sit together and we'll have a meal together and get to know each other. Before we start, I'd like you to bow your heads and we'll have a quick worship. So dear loving Father, we come to you today. We ask you to be with us as we share what we know and get ideas from others to live a healthy and fruitful life. We ask you to be with us in Jesus' name. Amen. Thank you all. Thank you, ladies. Now, have you all got one of these? Yep. If you want one, put your hand up if you haven't got one, and we'll get you one. You can take this away and keep it, but it's going to be very simple food and very simple cooking. We want you to gain as much as you can, mainly from the talk on diabetes and the education side of things. Okay, we're going to do the lentil and vegetable coconut curry, and as you can see, simple ingredients. Ingredients are going to be food, that's the one. And that's my son who's my helper today. He looks like a boxer, but he's good with the laptop too. What's, okay, you can turn that on now. Will it come up there? Yeah. Oh, that's good. Can you see it now? Okay, perfect. Okay, the first thing we're going to do is the lentil curry. So we're going to saute our onions, and I like lots of oil. Some olive oil. You can use whichever oil you prefer. Olive oil has its benefits, so it's always good to use the right oils. We use coconut oil also at home. You can buy a huge tub of coconut oil from Costco these days. So when the oil is a little bit hot, chop in your onions, just your diced onions. And we're going to fry this off till it's a bit translucent. All the vegetables that you can see here are beneficial for diabetes. They are high in fiber. The more fiber we have in our bodies, the better it is for us to be able to process that. And the more fiber we have, we feel full. So if you're like me who likes to be picking all the time, if you have a solid meal and a good meal, a nutritious meal, You're not going to go looking for something else. We're not going to go looking for sugar. Let's have a little bit of sugar to fill that craving, because you're getting your nutrition from all the vegetables. So the vegetables that we're using today is cauliflower, pumpkin. I know your recipe doesn't say pumpkin, but I don't go by recipes. I go by what is in the fridge. So you can use any vegetables, any vegetables that's good for you. Zucchini. You don't need too much, but whatever vegetables, at the end of the week, whatever you have left over, carrots, high in fiber and beta carotenes, you can use that. Now once that's frying off, you can add garlic. Oh, I forgot a teaspoon. Oh. Love this. Okay, now garlic has its own medicinal properties. So, if you're like me and you're not afraid, chuck in as much garlic as you like. Don't splatter everywhere. Okay, so you can fry off that garlic. Oh, and I didn't get my curry powder. That's all right. Now, the curry powder that I'm going to use is a blend that I have made. Now this blend, I've made this. And any of you, after you taste the curry and you would like a jar of this, you're more than welcome to purchase it. Down here, we're doing a fundraiser. So anything that we sell, we will keep for our next cooking demo. Okay, so this curry powder has all the ingredients you will need. It's not Keen's curry powder, it's Burns curry powder. So you can put a little bit enough. I'm going to chuck in some stock, so I've stopped the burning. I've not used this cooking thing before. I'm so used to gas. This gets a bit too hot. We want to be able to fry off the curry powder. My curry powder is already roasted, so you don't need to, it won't have the raw flavor. So even if you put it in at the end of your curries or at the end of your stews, if you make a soup and you feel that needs a little bit of a bite, you can put that in. This is very mild, but my mild, like my friends would say, is not really mild. Okay, now we're going to put the cauliflower. Keep stirring it through. Pumpkin. The good thing is all these vegetables cook up together because they're soft vegetables with lots of fiber but lots of liquid too, and they will all cook in the same time. If you were putting in carrot, you would want to cook it together with the lentil so that it cooks. Carrots are a bit harder. So the carrot would cook together with the lentil for the 20 minutes and you've got a beautiful mix there. I'm going to hide this now. Okay, once we've got all that together, all the veggies together, simmer for 10 minutes it says. This is when I like to put in the pre-cooked brown lentils. I've cooked it this morning, so you've got the pre-cooked lentil here. That's how it looks in the jar. You can buy brown lentils. This is brown lentil. You can do brown lentils, you can do pink lentils, yellow lentils, any lentils. The good thing about lentils is, like you can read on the screen, what it does for our body and what it does for... Have we got the screen? No. You can go back to that. So you want to blend this in together, and lentils, when it's cooked nice through, it's going to be creamy. You're still getting the fiber, everything is in there. All the vegetables are in there, the lentils are in there. You're going to get the fiber out from all that. Plus, you're going to get the lentil to be more creamier. The longer you cook lentil, the better. You're not going to lose the fiber because it's all going to stay in the pot. Now at this stage, if you like to add more, so funny spoon. If you like to add some more of your vegetable stock, go for it. Depending on how you like your lentils cooked, do you want it to be watery? Do you want it to be thick? For what we are eating tonight, I've already prepared a huge pot, but I used yellow, 4 different lentils. I got the brown lentil, the yellow lentil, the pink lentil, and another lentil which is mung bean. So I've got tur dal, we say tur dal, which is this, without the coating, without the fiber on the top of it. Makes it just creamy, and this thing will last in your fridge for at least 3 to 4 days, and the longer it sits, the tastier it gets, because all those curries are going to infuse together. Some people would add a can of tomatoes to this. That's what my mum would do. She'd put a can of tomatoes, put the cover on, and wait for it to all get together into a big mush. Now, before we finish that, you can add your coconut milk to this. You can either add it now or you can add it to the very end. I like the coconut milk cooked through, because when it's cooked through, you don't get that fatty flavor. So I'm going to you can put a whole can of coconut milk in this. And salt to taste. I cooked the lentils with a bit of salt, so I'm not going to add any more salt to that.
Can I just ask a question?
Yes, sure.
That particular milk, where did you purchase them?
This one you can get them all in Safeway now.
That particular one?
The cards are very, very thick and pure coconut milk. But I went to Costco and bought a whole box. You can buy a box at Costco, it's way cheaper buying a box. Because the coconut milk we get in a can doesn't seem like coconut milk to me. This is coconut milk. The ones in the can, you've got to get the coconut cream for it to actually look like coconut milk. The coconut milk is a bit watery. Okay, so you bring it to this consistency, leave it, let it cook for about 20 minutes till it cooks through. Take it off. You can serve it straight away. You can cook it, keep it in the fridge, cook it for a couple of days. And when it's ready, you can garnish that with some coriander, and you're good to go. Any questions for me? Let's get back to that slide. I just want to talk about some of the spices that I've used there and why we use those spices. What does it do for us? We Indians love our spices. That's why they call us curry munchers. Not for nothing. I'm glad Josiah's here. I wouldn't know where to click. Lock it all up. Okay, so what does our lentils do for us? It lowers and slows the rise of our blood sugar. When our blood sugar is rising, that's when our diabetes is going to kick in. And if we don't go to be tested regularly, we would never know what foods to eat. And we continue to eat the same things, make the same mistakes, and wonder why we're feeling so sluggish. So studies show that lentils can reduce postprandial blood glucose. I don't know what that means. Lamnu, you can tell us.
Blood sugar readings afternoon.
Yeah. So it really reduces that. Have lentils at least once a week. We have lentils every day. If you're an Indian, that's our staple food. We love our lentils. We always have lentils in our fridge because we have different types, different ways of preparing them. So you don't feel bored eating the same thing. Food should never be a boring thing. Food should be exciting. We want to be able to have that food. And yeah, I'm going to have lentils tomorrow, but it's not going to look like that. It's going to look different. It's going to taste different. It's what you put with your lentils that's going to make the difference. People would use the brown lentils. You can soak that. It's best to always soak your lentils because if you don't soak your lentils and cook it straight away, you'll have a lot of gas. And then you'll be blowing the trumpet too much. So soak them overnight. And when you soak them in the morning, when you wake, you find little bubbles on the top. That's all the gases that are coming out of them. So you strain that, keep washing it till it's nice and clear, and then cook it. It will cook way faster. This lentils took me like 15 minutes. I soaked it overnight, 15 minutes in the pot with a little bit of water, and it was done. You can pre-cook lentils, put them in an airtight container, put them in your fridge, keep them for a couple of days, not too long, because they will go off. But these lentils are high in fiber. Any lentils can be good for you. While that's cooking, I'm going to cover it up, and I'll get the ladies to continue with the program. If you don't have any questions, can you move to that last slide, son? Keep going.
That's the very last slide.
No, last slide about the benefits of spices. Our food doesn't need to be boring. Yeah. So all those spices are in this little jar and more. So the main spice in this would be the coriander powder, turmeric, cayenne pepper, or chili powder. I use Kashmiri chili powder, so it gives you a beautiful color, but it's not hot. It tastes more of a capsicum. Black pepper, very little black pepper in this. Cumin powder, high in iron, very good for our body and our digestion. Ginger powder, same thing. Anytime we have, it has ginger powder in this, lentils go with ginger. Back home, if we ever have anything to do with lentils, we always have either a ginger soda or a ginger drink because it brings out all the gases and you don't feel bloated. Some people will say, I can't have lentils, I feel so bloated, because it's just sitting there. Maybe they've not pre-cooked those lentils properly, or they haven't soaked those lentils properly. So ginger's very good, and ginger also has antioxidants and relieves a lot of things, nausea. Fenugreek powders, when you, I can pass this around, Lamnu. You can have, when you open the jar, you can smell fenugreek. Fenugreek is a strong flavor that gives the curry its smell. Very good for blood sugar and cholesterol. Fenugreek. I should have brought some fenugreek seeds. With fenugreek, you can soak those seeds overnight in water, in cold water, and the next morning drink that water. Very good for you. It's very good for cholesterol and blood sugar, and controls all your LDLs. Garlic powder, we all know the benefits of garlic. I put garlic in that, plus there's garlic powder in our curry mix. So everything that we have in nature that grows from the ground is good for our bodies. So the further we stay away from processed foods, the better for our health, because food needs to be our medicine. So if we keep that in mind, we will live healthy lives. Okay, who's coming up next? Lamnu?
What diabetes is and the different types of diabetes. And we will describe the causes of it and silent symptoms and risk factors very briefly. So the prevalence globally, 1 in 9 person are living with diabetes, which is between 20 to 79. They didn't count the little 1 to 19 years old. Yeah. Oops. No. Yeah. Or the first one? Yes. And 1 person dies every 9 seconds. About 3.4 million deaths in 2024. This is from International Diabetes Federation source. So in the next 24 years, they were predicting the prevalence will increase up to 49%, which is huge. So let's look at in Australia context. 1.9 million Australians have diabetes, almost 1.9. So last year, 120,000 Australians has developed diabetes. So 1 new case every 5 minutes. So every day around 300 people are diagnosed with diabetes. There's a lot of people undiagnosed diabetes. This is statistics depend on National Diabetes Services Scheme stats only. So diabetes is the 7th leading cause of death in Australia. So Aboriginal and Torres Strait Islander Australians are 3 times higher risk to develop diabetes type 2. I won't read it, you can read that one. So every year, 1.3 million hospitalized with diabetes-related condition, so which is a huge cost of money for the government and burden of disease. So I will only highlight the imputation. There's a lot of complications, but this is one of the costly related to diabetes complications. In Australia, according to the research, 4,400 amputees because of diabetes. So we might not realize, isn't it? There's a lot. And the second highest rate of amputation, Australia is the second highest rate of amputees. The diabetes-related complication, unfortunately. So the cost of providing health care for people who has diabetes complicated health food ulcer are 5 times higher than diabetes who doesn't have diabetes food ulcer. So which is scary and it costs a lot of money. The other thing is 85% diabetes-related amputation are preventable. This is very important. It's a preventable cause, so it's important to be aware and to educate people more and more so that they don't reach to that stage. People with diabetes or lower limb amputation stay in hospital much longer, may average 26 days. So that's why I just highlighted that amputations is more 85% preventable. So I think it's very important to make aware in the community. So this is just a picture. I like a picture so that we can understand a bit better. So the normal blood glucose system. So what happens is when we eat the food, I will also explain through a bit later. When we eat, the food goes to our mouth, our esophagus, go into our body and bloodstream, and the pancreas release, and the brain send a message. The pancreas started releasing the insulin. Insulin acts as a key to unlock the door to pass the cell body. So without the insulin, the food that we eat cannot use as energy. So in the picture, as you can see, the key is the insulin, a little blocks the sugar molecules. So they need to pass to the cell body so that our body can get energy, our muscle can use those energy. So the food broken down into glucose, those are in the bloodstream, and the pancreas is releasing the insulin. Insulin acts like a key. That way the glucose can go to our cell and we get the energy. Next, please. So this is more what's on the computer, but if you can see, this is the normal blood glucose in our bloodstream. So diabetes is a chronic condition because it's very high sugar in our bloodstream for a long period of time. Because the pancreas are not able to produce enough insulin. And the body is not able to utilize it. And the insulin is not very effective. Okay, and then when there's not enough insulin production, the glucose stays in the bloodstream for a very long time. So when insulin is not enough and not able to use effectively, what happens is excess sugar in our bloodstream. Next. So I already explained, but for those who can learn a bit easier with the picture, I just put this one. We already touched this. So food goes in the bloodstream, and then the sugars change as a sugar. And then this next, and go next. And then the insulins and the glucose, the good food that we eat mix together and then pass it onto a cell to utilize this in order for us to be able to function, to the things that we don't use as energy, store in our muscles, stores in our liver. So when we fast, those can be utilized again. Next. So risk factors. We all aware a lot of risk factors already, but I will try to explain as much as I can. So the risk factor, unfortunately, it's number one is age. The more we get older, the higher risk, because our lifestyle greatly impact. Because we move less, we tend to eat more. Yeah, not much, but our metabolism is slower. That is also the risk factor. And family history, strong family history, unfortunately. So if you have a family history of diabetes, you are more likely to have diabetes later in life. Higher risk compared to no family history. Ethnicity and cultural background, so high risk in Aboriginal and Torres Strait Islander community, and Asian background. So, yeah, Asians background, and Indian, Chinese, we all are Asians.
Is that because we eat too much rice?
Probably, yes. Yes. And medical history, so women who are pregnant and has high sugar in the blood because of the hormone causing the placenta is not able to function properly during their pregnancy, so they call it gestational diabetes. So for those who already had gestational diabetes, 50% chance of developing type 2 diabetes in the future. And another risk factor for women with polycystic ovary syndrome. So we have the ovaries, the cysts, our eggs are not mature enough and they stay in our ovary and they are not mature. So many eggs are there and then it can cause insulin resistance. So women has a lot of issues, isn't it? So the other one is the medications. People who are on asthma medication or steroid medication because they have lung problem or breathing difficulties, the doctor might put you on a steroid medication. Or some people who have severe arthritis, they are on certain medication to reduce the inflammation, and those things can induce type 2 diabetes. They call it steroid-induced diabetes. And other thing is, if someone is on a prolonged period of antipsychotic drugs, which is mental health medications that can also trigger and elevate the blood sugar in a long time, and immunosuppressive people who are on chemotherapy or some other immunosuppressive therapy can trigger also can trigger type 2 diabetes or diabetes related condition. Risk factor that we can improve. The previous one, we can't change, we can't modify. But this one, the good news is we can modify. So weight, number one, as we all know, excess body fats, especially in central obesity, we call it in the waistline. That's where all the fats are stored, and increased risk of diabetes. And little movement because of our extra weight that we carry, and we are unable to move a bit more. That can also contribute a huge contribution of increasing diabetes risk. As we all know, diet has been a vital part of this risk factor because the food that we eat changes sugar, and the body is not producing enough because the body is resistant, the pancreas is resistant. The more we put high sugar in our bloodstream, the exhausted, the pancreas is not coping at all. So the high sugar, the processed food we eat, that can also increase risk of diabetes and also low fiber intake as well. And smoking, I think that is not a big issue for us at the moment. So I won't discuss that one. And blood pressure. This can be quite common in the community. The blood pressure alone can also be high risk of diabetes as well. It can link to inactivity, and also the blood pressure can be caused by chronic stress as well and genetic. So this is one of the very high risk factors as well. And then elevated blood cholesterol level in our blood, that can also increase heart problem and diabetes. We already touched about the medication, if you're a steroid or if you're other medication. Next, please, thank you. So you would heard a lot of diabetes type 2, but not much type 1 and other types of diabetes. But as you can see on here, the statistic shows 85 to 90% of diabetes cases are type 2, which is modifiable, and generally over 30 years old, but nowadays more and more younger kids and younger people develop type 2 diabetes, unfortunately. And as we already mentioned, it can be genetic, and it triggers by lifestyle, obesity and inactivity, and illness and stress. Type 2, we still have insulin, but we have less insulin production, and the insulin that we produce are not effective. But type 1 has absolute lack of insulin, and 10 to 15% of cases are type 1. Type 2, type 1 has absolute lack of insulin, and completely the pancreas are completely destroyed by beta cell. And generally, type 1 person with type 1 are more lean, and they don't carry much muscles and much extra fat. It caused by autoimmune, so generally with babies and younger, but now, excuse me, now more and more young adults or older adults can develop, can have. Thank you.
That's the curry.
So the other one we call is latent autoimmune diabetes of adulthood. I don't expect you to understand this one. Some people might be misdiagnosed as type 1, type 2, and then later in life they can classify as type 1, because when they were diagnosed as type 2 diabetes, they're still producing a little bit of insulin. As time goes by, the pancreas has been exhausted and they no longer produce the insulin. So they classify later in adult, they classify as type 1 because they completely lost the function of insulin from their pancreas. So that can be identified by doing a blood test. So now it's more common. People with type 2 classify as type 1 if they show the symptoms such as severe weight loss and the blood sugars are consistently high and low despite modifying their lifestyle and diet. So those are the symptoms that you need to be alert and talk to the doctor to do another investigation to classify what type of diabetes. So this is a summary. Type 1, no insulin production because of the beta cell destructions from the pancreas, and because it can be because of the infections, because unknown cause of destructions in the pancreas. Type 2, insulin resistant, with type 2 still producing insulin but not enough or not effective to use by the cell body. Type 3C or type 3, this is others, can be autoimmune disease or can be caused by pancreatitis, inflammation in the pancreas, or can cause by infection and somebody has to remove completely the pancreas. So in this case, they can't be classified as type 1 or they can't be classified as type 2, they are called type 3C. Or someone with cystic fibrosis and they later in life they no longer, the pancreas is not functioning at all, so they are under the type 3C. So gestational, during pregnancy, they have high blood sugar. So globally, the prevalence of gestational diabetes in pregnancy is 1 in 5 person. Next one, please. All right, the symptoms of type 1 is, we can keep going. As we said, this is around 10 or 15%, so you might see some, but not many. So frequent urination, frequent thirsty or excessive hunger, and massive weight loss, and blurry vision and numbness and tingling, those symptoms are type 1. We'll just go next one. So the type 1, as we already mentioned, our pancreas is different beta cell, alpha cell, and delta cell. But for type 1, they have a particular beta cell destructions in the pancreas. That's for the picture. Yeah, so that, and they need 100% insulin. They have to have insulin 24 hours, 7 days a week to be able to function. Because the pancreas is completely destroyed and not functioning. So I'll go through type 2. This is the top yellow one is pancreas, so that we can visualize. And the insulin is the green one, and the sugar is the little blue dot. And this is our body cell. All right. So for the normal function, the body cell can get all the green insulin and sugar together, and the sugar are converted as energy, so we can utilize in our muscle, in our brain, the part of the body to function as energy. But type 2, it was resistant, so the sugar cannot go through. There's only a few insulin available to match, to receive energy. So there's lack of energy in our body cell. So we feel tired. We cannot concentrate. Our body is not functioning enough. We can't concentrate. It's so blurry and it's hard to function daily. You feel thirsty because your body is trying to get energy as much as I can, but you don't have enough energy and you're trying to get rid of sugars are in your bloodstream. When there's too much in the bloodstream, the body is lack of energy, and the kidney is trying to get rid of those sugar. And they can't go by themselves. They need to get other source of. They're trying to get water and potassium, so that everything they pull it out in the kidney. What happened? We lost of fluid and we are dehydrated. and we feel exhausted, tired. And the symptoms of type 2, I'm sure you would come up with a few symptoms. You might be aware of your friends or families or somebody might have this kind of symptoms. So frequent thirsty, we've seen people come into the hospital or clinic they drink liters and liters, 2-3 liters, they've never enough. They keep drinking and they keep, asking for some more. Those are the first sign, very prominent sign of type 2 diabetes. And frequent urination, very similar with type 1, but type 2 doesn't present with massive weight loss. The blurry vision are pretty similar, tiredness, tingling, and numbness, infections, those are commonly similar. The differences with type 1 and type 2 are massive weight loss and with the features and age. So type 2, normally we call it non-insulin dependent diabetes, but now more and more type 2 diabetes are on insulin. It's mainly happening in adult, but now as we already mentioned earlier, also in more younger people becoming type 2 diabetes. 90% of diabetes cases worldwide are type 2. And I'm going to go back for the link to lifestyle. It's a slow onset. It doesn't happen in one day. It accumulates years and years. For some cases, no symptoms at all. So they just found out through normal health check from the GP, or they went to the hospital with other cases and they did a blood test, and that's where they found out. So type 2 are very difficult to find out if they're not proactive with their health and if they don't present with those other symptoms that we mentioned. So it's very important to keep an eye on the symptoms and regular health check with the GP. The other features of type 2 are some people might be presenting or telling you that, I have a burning sensation or tingling and numbness. Those are another sign and symptoms of type 2 before the diagnosis of diabetes. And some people might be having velvety darkness of the neck or the armpit. Those are one of the signs as well. So we already know the central obesity and blood pressure high and cholesterol high in our bloodstream. Those are the common features as well. All right, I'm almost done. The major complications of diabetes, I think this would be the much easier for me. So the first thing that causes these organs are not impact straight away. It can impact a long time, like 4 or 5 years. But some people come in with kidney problem and they end up with type 2 diabetes. Some people come with heart problem there. We found out that they have diabetes. So they are like a family, unfortunately. So I'll pass it on to you. These can cause each organ that are impacted in the bloodstream and plus because of diabetes. So we all can read together. The high blood pressure and high blood pressure can damage the eye because the little tiny blood vessel behind the eyes, when the pressure is too high, when the sugars is too high, the pressure behind the eyes is high, can bleed. The tiny blood vessel can bleed, and that way you can experience eye problem, blurry vision, and prolong if we don't treat it can cause glaucoma. And I'll also just give you this one, and you can try to do checking, looking at these glasses through the glasses. These are common long-term complications of eye problem if we don't control our blood sugar properly. And the kidney problem is, as we already mentioned, the body is trying to get rid of the sugar, but when the sugar is too much, it's quite greasy, isn't it? And we have a tiny little blood vessel and filtration system in our kidney. So they started sort of, we are leaking protein in our blood, our urine, and they're working so hard and they're not able to absorb the sugar properly, and they're not functioning. I would say they're not functioning well, and they're exhausted. They're getting damaged. And the important thing is we need to check our kidney function regularly and drink plenty of water and make sure our sugar range are in target as much as we can. And the neuropathy, it's damaged the nervous system and also the brain. If the blood sugar is too high, blood pressure is too high, what can happen is it can lead to strokes and also cognitive impairment. And Rachel's also mentioned to me before, the new research found that that's a cognitive impairment or Alzheimer or dementia also linked to diabetes, because this elevated chronic blood sugars can damage the functions of our brain and nervous system as well. We'll hear more and more research studies about this link. All right. The type 2 diabetes, how we manage it, as we all know, lifestyle, regular exercise. The Australian health recommendation is at least 30 minutes a day, and healthy eating, weight management, at least 5 to 10% of weight. If we can reduce the 5 to 10%, that is a really good control for type 2 management as well. And the other important thing is regular check-up with the doctor so that you can measure where you are. So the diagnostic, maybe I find might be useful for you. Your doctor might be doing fasting blood glucose testing, and we don't look at one testing abnormal. We look at two to three testing. If it's abnormal, then the doctor or the diabetes team will confirm confirm that you have diabetes. And sometimes you might have random high blood sugar at fasting, and if you're not sure, you try to do it the second or third time. And sometimes you might be quite stressed, or you're having high sugar content before you do the blood test. That can also give you incorrect readings. And random blood glucose, when you go to a CGP, they might do random blood sugar testing with 11.0 readings. That will also indicate or prompt the doctor to do further testing. And oral glucose tolerance test, which is the 2 hours glucose testing. If your sugars are 11.1, that is also another indication you have developed diabetes. And hemoglobin A1C is above 6.5. This can be one of the diagnostic, but some people who has low iron level, their readings will become low as well, so we can't just rely on this one. All right, this one we can keep on going. There's no particular food for diabetes. Diabetes is pretty much how much carbs and how much portion we're taking. The food that we eat, we need to be very focused on how much we eat in the carbs contents. But that is a long talk, so I won't go through, but I'll just quickly touch. And next time when we have a dietitian, we can do another presentation. So the role of food in diabetes is to nourish our body and help manage the blood glucose level and manage the cholesterol level and can help to manage your weight. As I said, there's no particular diabetes food. As long as we can follow the food, the recommended portion and types of food. The main impact in the blood sugars are the carbs in diabetes. Carbs has been a great impact in our sugar. Our protein, fats can impact it, but not spiking. They can control. They can give you a good range in protein and fats, but the carbs that we eat, and some carbs are very high index of sugar, some carbs are low. So the things that we need to do is what are the high in carbs and lower glycemic index and carbs. I could not go through that one because of the time limit. So next time when we have time, we will go through low and high glycemic index, which is carbs contents in our food. You can keep going. Or mainly portion size. When we eat carbs, it should be one size of our feast would be carbs, and one size, 1/3 of our food should be protein, and half would be fruits and vegetables. These are the recommended. So, as Bern presented the food, we will try to mimic this size, the portions, and the type of meal that our daily intake, to reduce our carbs intake so that we can balance, our sugar level. So, yeah, pretty much I can't really go through the carbs, so I'm sorry, but I can show you this one. And keep passing through. Yeah, and if anyone wants to do measurement on their waist, more than welcome to do. And there's a guy, a line can show you the ring will show you where you are, and the red. If you want to do, feel free to come and measure. You don't have to, but if you want to. And if you want to come and look at take a photo of this, I was trying to order this one, it was too late. Because Leaf Lighter have a little nutritional guide to control diabetes. For example, within the fats should be under portion, like for example, the sugar should be under 5 to 10 or 15 grams. So sodium and fiber, the higher the fiber, the better. The carbs and total fats. If you want to take a photo, more than welcome to do. There's a little 2 things for you guys to do. And yeah.
Any questions for Randy?
Yeah. All right. Any questions?
Yeah, in the plate.
Yeah.
In the plate distribution, half is the vegetables, and the others. What about the fruits?
The fruits come under the vegetable.
Okay.
Yeah. But the fruits also recommended not to have more than one palm. Like when you have, for example, one size of 1 palm is 1 serve. We don't want 2 serves at the same time. Otherwise, the sugar will spike. It's so high. But for those who doesn't have diabetes, it might not be relevant. But for example, if you're having 2 serves of fruits, that would be too much to spike the sugar. 1 serve and other veggies. You can spread it out.
What about the like chocolate that says it hasn't got any sugar in it, or it's stevia or whatever?
Artificial sugar.
How does that affect diabetes?
So people use artificial sugar in the hospital as well. They do elevate the blood sugar, but not as high compared to the normal sugar. So better than the normal sugar, but still impact a little bit. Yeah.
So fake is better than real.
Oh yeah. Because people can't completely avoid sugar, so they make it artificial sugar to substitute. But they're very interesting. For example, for someone, the sugar, certain food might be impacting very much in the sugar, but for somebody, it doesn't. So the same food, but everybody metabolism and the way you respond, the body's responding is different. But while you're eating that food, and if you're quite stressed, your sugar might come up very high. So it's not only one food or certain food, it's also impact with your lifestyle, environment, and if the weather is so hot and you're quite in stress, and your sugar will go up. So calming, relaxing, and choice of food. Portion is also very important.
Laszlo, are you aware of the education programs that are going out to the places where are very high diabetes, like our Aboriginal and Torres Strait Islanders? Is there an education program?
Yeah, the Diabetes Australia has, and we do. I work in the community in a hospital, so we run diabetes wellness program every 3 months. So at Fentree Gully, each Eastern Access Community Health, we do run at Patterson Street for Ringwood area as well. So we have people coming in as a group like this. We run 4 weeks. 4 weeks. First week is basic, what is diabetes, and then we have diabetes dietitian. We have a podiatrist. We have health psychologists and physiotherapists and exercise physiologists. So our team, we run all our topic together to cover all these things. And we do in-house, we do have all allied health services in one place, and endocrinologists as well.
What about frequency of eating?
Yes, that's very important. So it is better to eat smaller portion and every 2 hours instead of having a big meal. Because as we see, because when we eat, the sugars and the food that changes the sugar, right? It's going to the bloodstream. If we put a lot at one go, a lot of blood sugar will be floating in our bloodstream, and the pancreas is not effectively producing enough. So we try to compensate. We try to match how much our pancreas is producing. So smaller portion, smaller meal is a better option for diabetes. Our goal is not to spike too high, so to stabilize. Anything else?
What about the intermittent fasting? Like
That's a really good one.
or the 8-hour eating?
Yes, you allow your body to use the energy. So the food that when you know the muscle is storing some energy, the liver is also storing energy. So they started releasing those energy when we're not eating. Does it make sense? And you don't put extra sugar and extra food in it. So during that time, the body is utilizing the stored energy. So the sugars are more stabilized. But if you're on a certain medication, you can't. Your blood sugar will drop very rapidly.
Is there danger of going from type 2 to type 1?
It's hard to say danger, but it's unfortunately it's hard to manage. It's harder to manage type 1 because you have to be 24 hours, 7 days a week on insulin. And if you don't eat, you can be if you don't eat and have insulin, you can be very low, and it's dangerous. If you're eating too much, the sugar will go up very high. So you need to constantly manage your sugar intake. It is a very hard disease, unfortunately, and we need to make hundreds and hundreds of decisions a day before what my sugar will be, how much insulin I have to give. They have to think every single food that they're eating. But for type 2, not much.
I was just thinking, if your type 2 is badly untreated, can you go to type 1?
Not necessarily, no.
Okay.
But people can, if someone has massively weight loss and the infection can impact on the pancreas, then you can. The infection can damage the pancreas as well. So then the pancreas is completely not functioning. Then you become type 3C. But it doesn't normally happen for type 2 to become type 1, but the only thing is they misdiagnose and the body is, the body's change to the infection damage the pancreas. Then that's not what you're doing. The infection is doing it, so that's unusual.
Good.
Anything else?
Do you know that type 2 diabetes can be reversed?
They are doing research, and I have seen in my clinic, they are working so hard to modify their diet and exercise. They come back HbA1c low and they're normal, the blood sugars are normal. So I have to discharge the patient. You're managing quite well, you don't need to come back, but it doesn't completely go away. It's still, they can develop if they change their lifestyle again.
So it's basically, most of these cases, diabetes 2 and all that, is related to what we eat.
Pretty much.
There is a DVD, Forks Over Knives, I recommend getting that. Shows you exactly why we are having all these diseases Now, diabetes is one, but we have heart disease and cancer.
Yes.
Heart disease is number one killer. And now that looks like diabetes is catching up. But diabetes, we can prevent it.
Yes.
Total prevention. And basically is what we eat. And a lot of people are eating too much of the refined carbohydrates. What we really need to have is complex carbohydrates.
Yes.
Right, that breaks down very slowly. And the thing is, fasting is another way of actually breaking those cycles. A 3-day fast. We can reset the body's metabolism system and try to remove all the sugars from your body and reset the clock. And then we actually have 2 meals, not what you said, the small portions regulated, that's not actually good because your body, your stomach needs to rest. It's a machine.
Yes,
right?
it does.
It's a machine. It needs to
I
rest,
agree, but some people.
and recover.
Yeah.
So what we need to do is when we have complex carbohydrates, you don't get hungry. When you have it in the right portions, you can have 1 meal, and generally I only have 2 meals a day. Breakfast and a little bit dinner, that's it. And that's all you need. And if I had lunch, then I skip the dinner. Don't need that much food. You're not going to die, so you don't need to worry about it, right?
Every body and metabolism are quite different.
The thing is, they also that with the diabetes, you're talking about the insulin and the production in the pancreas, the insulin, and you go to glucose.
Yeah.
And everything that we eat is turned to glucose.
Yes.
Right? That's your energy. Now with type 2, the problem with when you have insulin, you got a lot of insulin. You don't have to listen. You gotta get insulin. That's why you get type 2 diabetes.
You don't have enough insulin.
What happens is this: the insulin is there. The insulin cannot open the cell. There is what you call a fat in front of the cell. So when the
cannot utilize it.
Well, the insulin is the key, right? Now you have a cell here, and your cell membrane, you have a fat layer there. When you have fat, the insulin can't go and open the cell, and the glucose is now increasing. As the glucose is increasing, it produces insulin. That means you can't actually put the insulin. The insulin can't open the cell, can't put the glucose in, so you have type 2 diabetes. The other thing is remove fats, all fats.
But remember, there are some factors cannot preventable. Some factors are genetic. Some factors are medication causing. Some factors are, so there's some category we can prevent, some category we can't prevent. I think I put it down clearly.
Thank you. Thank you so much for your talk.
Your voice is quite
So we pre-made the salad because everyone can chop some veggies and everyone knows how to make a salad. So we have got cucumber is the main ingredient in this, and cucumber pairs really well with a curry. It's very cooling, so they work well together, as well as a mint as well. So we've got a cucumber lemon herb salad. It's a great diabetes option. It's low carb, hydrating, high in fibre, and very rich in antioxidants as well. And the cucumbers, they contain flavonoids and tannins, which help to reduce inflammation and oxidative stress, so damage to the cells linked to diabetes complications. And lemon juice, everyone loves a bit of lemon juice in a salad, so like vinegar, it can lower the glycemic impact of meals by slowing the digestion and improving insulin response, which is a great diabetes friendly dish, and it's going to pair well with the curry when you try the curry. So I'm also going to just have a quick chat to you about some herbs. When I was doing research into herbs and what herbs are beneficial for diabetes, there's actually a whole range of herbs that are beneficial for diabetes. So I've just listed 8, and I'll just go through a few points with you when it comes with that. I'm not as fluent as Lamnu, so I've got my notes here, which I'll be referring to. Did you want to pop it on the next slide? So, just when we're thinking about herbal remedies, Natural doesn't always mean harmless. We still have to be careful. And I'm not talking about just like putting a bit of cinnamon on your porridge or adding a bit of turmeric. I'm talking about therapeutic doses, because when it comes to herbs, it's all about the therapeutic dose. How much are you bringing into your diet? So the first herb that we're going to talk about is aloe vera. Now, when we think about aloe vera, we're thinking about probably burns. But aloe vera, it has inside of it, it has the gel part, because the outer part is you might use that as a laxative. So there's different parts of the plants that you can use. So with aloe vera, you use the inner part, so it's the gel-like part. So that's full of it's full of carbohydrates. And that's going to help slow down when you eat it together with the food. It's going to help slow down the digestion. You can see in number 2 here, just like with the spike, it's just going to lower the spike. So that's a good herb that you can include. So what makes it interesting is its potential to protect your body from the wear and tear of diabetes. So animal studies, they suggest that aloe vera gel may help protect the liver and help the kidneys from damage. It may also improve the markers of organ health and reduce the cell damage linked to high blood glucose levels. The next one we have is fenugreek. I think Bern touched on this already, so I won't go into that too much, but that's another herb that can help. And you'd have to talk to a health professional as to how much you'd actually include this. Obviously, you want to include in your diet. And it also has a lot of fibre, so you just have to be careful taking it in huge quantities. But your normal day-to-day, obviously your day-to-day use in cooking, it would be fine. Now, we've got the next one is called Tulsi, which also is called holy basil. This is one of my favourite herbs. It can do quite a wide range of benefits in the body, but specifically for diabetes, it's been used in Ayurvedic medicine for thousands of years. So that's the Indian medicine system, and it's one of their most popular herbs. So it's backed now by science, saying that it's a powerful tool for managing blood sugar. And the human studies have reported that Tulsi can significantly decrease both fasting and post-meal blood glucose levels. Next one, cinnamon. Cinnamon is a lovely spice. Who doesn't love cinnamon? I think most people love cinnamon. This one we call the cell whisperer because of its unique way it helps your body's cells communicate with insulin. So cinnamon it's more than just a flavouring. It contains water-soluble compounds that act as an insulin mimicker. So basically they pretend to be insulin to help your body process the sugar. And research shows that these compounds, they activate the specific enzymes that turn on your insulin receptors, while blocking the ones that try to turn them off. So basically it's in experimental models, it was so powerful that it increased glucose metabolism 20-fold and significantly reduced blood sugar levels in as little as 2 weeks. Okay, now this one, some of our community might know this one. I haven't really tried this food, so I've got a few food in here as well. So this one is called is bitter melon. Who's had bitter melon before? Yeah, so apparently it's widely known in Asia and Africa. It's got a powerful way to help your body move sugar out of the blood and into the cell. So it's referred to as the vegetable insulin. It contains a compound that acts as an insulin sensitizer, essentially helping the muscle cells unlock the doors to absorb all that circulating glucose. So in clinical trials, combining melon extract with just half the usual dose of drugs like metformin were more effective in lowering blood sugar than taking a full dose of the medicine alone. But I just do want to point out, just on the safe side, always consult a healthcare provider if you are wanting to introduce these into your diet. Okay, then we've got the next one is gymnema. So this is another Ayurvedic herb, and it's known for its blood glucose stabilizing. So it even has the nickname as the sugar destroyer. So it's fascinating because it starts working the moment that it touches your tongue. It contains compounds that physically block your taste buds from being able to recognise sweetness for a short time. But the real work happens inside your digestive tract. It acts like a no-entry sign in your small intestine, physically interfering with the machinery that absorbs sugar from your blood, from your food into your blood. So even more exciting, research suggests that gymnema may stimulate your pancreas to grow new insulin-producing cells, helping your body regain some of its natural ability to manage sugar. Okay, and the last one that I have here is another food. It's oats, because it's always great to be able to have food, and as Bern was pointing out, we want to have our food as our medicine. So it contains a soluble fibre called beta-glucan that turns into a thick gel in your stomach, which helps to slow the digestion and reduce the blood sugar spikes after the meal, while also supporting your heart health. Okay, and then, one more. Who can forget garlic? Garlic is just amazing. It does so many things, has so many benefits in the body. So it's the research shows that garlic contains special sulfur compounds that stimulate your pancreas to release insulin more effectively. So it basically acts like a volume knob, turning up the effectiveness of your treatment. So that is definitely one that we can all include in our diet pretty much every day. I think I eat it every day. When I cook, it's always onion, garlic to start with. All right, next one. So like I said at the start, there's a lot of things that can help with blood, with your blood glucose level. But if you are wanting to incorporate them, maybe just see your health practitioner. Okay, thank you. Okay, now I think we've got the dessert part of our menu for tonight. I think Mary Chris was going to come up and talk about that.
We'll come around and give you a meal, and if you want more, there's tons of food there. Please help yourselves. Where are we? Yeah. We've done the salad. The salad, very simple salad, but each vegetable in the salad is useful for us. So the chia and berry parfait, that's our dessert. I've also got, some of us may still want a little bit of a sugar hit. The berries should be sweet. It can be a bit tarty sometimes with some yogurt. But if you like, you can always put some date syrup. I've got some date syrup, so you can put a little bit of a dash of date syrup on it, and give you that little high fiber, plus making it a bit sweet. What's on the next one? Next one? Okay. This time we concentrated on diabetes. Our next session, we'd love you all to come back. We're going to concentrate on heart health. So we're going to source a nice person who can give us some information in the medical field, who can come and talk to us about heart health, how we can look after our heart. If our heart functions well, our brain will also function well. And then after heart health, we've got to go to gut health. Our gut as well, our whole body as well. So we've got to concentrate on gut health, heart health, the things that's happening in our community, what's really affecting us. Why aren't we having a clear mind and a clear body? So we want to tackle those things and see how we can help as God's children. We're all here to help each other. None of us has it all, but we're all here to learn from each other. So come and grab a meal. Before we grab a meal, I'll get Pastor. This is our pastor, Pastor Steve.
Sure.
Do you want to come up and introduce yourself, Pastor Steve?
Yeah, I'm Steve, for those that don't know me yet, and I'm the current pastor here at Rowville. It's an honor to be here tonight, and I think we've all enjoyed ourselves. I just want to give a big hand to all the ladies that have done this, and this is just amazing, isn't it? I think we should have more of these. Thank you for your leadership and for your team as well. So let's all bow for prayer. Let's pray. Our Father in heaven, we thank you that you have given us food that is good for our bodies, for our soul as well. We thank you for all the things that we've just heard, all the things that we've just learned, and help us, Father. Give us wisdom to apply them all in our daily lives as well. Bless the food that we are about to eat. Father, as we explore and as we enjoy one another's fellowship, help us to draw closer to you and to one another as well, in good health and with your blessings too. All these we ask in Jesus' name. Amen.
Amen. Thank you.
Thank you.